Hello, this is Dr. Lori. Welcome to this discussion of case control study designs. In a case control study design, what we're learning about is something that has happened to two groups of individuals. Specifically, if we think about this as our timeline, we'll put T for time, we know that at some point in time, the outcome of interest has occurred. And at that point in time, we collect information from both our cases and our controls, and hence the name case and control. Now, the thing that differentiates this from a descriptive design is with descriptive we're not really comparing two groups, but now all of a sudden we have this possibility to compare two groups. And one of the important things to remember is we may collect information about these cases, but we don't know what we would expect in a random, average, normal group of people. And so the controls really serve to help us understand what's expected. So I'll put EX for expected. The controls help us to see if what we're seeing in the cases is more or less than what we would expect, or if it really is just the same for any given exposure. Now, with a case control study, it is considered to be a longitudinal study, and so we're asking those people, both the cases and controls, to remember back about certain exposures that happened, and we're specifically thinking about asking them to tell us about exposures that give an adequate amount of time. Let me extend our line there a little bit. So here, if we have our exposure, this amount of time in between the exposure and the outcome needs to be long enough so that the disease could have time to develop. So I'm going to use an example of neural tube defects. I'll abbreviate that NTD. A neural tube defect is something that a baby is born with. And for a long time we were trying to figure out what causes neural tube defects. How can we figure out what causes it so that maybe then we can help to prevent it? These cause very severe problems. Often the babies are born and they don't make it because they're so severe. It affects the brain and the spinal cord, which are very important organs to life. So what we want to find out is what are exposures that happened way back here that we could possibly understand better about neural tube defects. So when we think about both cases and controls, there are a few things to keep in mind. Specifically with the cases, first of all, we have to define what a case is. And so that definition, often for this whatever outcome that we're thinking of, is the first step in doing a case control study. Now, we don't want to make that definition so narrow that we don't really capture the variety of neural tube defects or whatever the outcome of interest is, but we also don't want to make it so wide that we include things that really are not neural tube defects. So coming up with a clear definition is really very key to a case control study design. The second piece about understanding cases is how are we going to collect cases that represent this particular outcome. With neural tube defects, that actually is fairly straightforward because congenital anomalies are something that are reported on birth certificates, and birth certificates are considered a vital statistic that are collected on every single birth. And so in that case, we would probably go to the birth registry and look through the birth certificates and locate cases of neural tube defects based on the ICD code system. For other outcomes, if there is a registry, like a cancer registry or some other kind of registry, we could tap into that. But you can see pretty quickly that there are a number of things that we would want to study that maybe we don't have a registry, it's not reported on the birth certificates or some other standard way of reporting that particular outcome. And so coming up with that definition and a feasible way, operationalizing how are we going to collect these cases becomes really important to define how that's going to happen. Specifically, we would like to capture all of the cases in a particular population, and we do not want to capture as cases anyone who is not a case. So that would be the ideal. We would want to get every single case and no non-cases. So that's our goal, and that's harder to achieve than you would believe. The second issue then is to capture controls. And for the controls, we think about having them be from the same population and to be similar to the cases in every way except for the exposure of interest. Now that's complicated because often when we're doing a case control study, we don't actually know yet which exposure is the exposure that's going to come to the surface that ends up being the important one. And so decades back, there was a syndrome that infants would have. It was called Reyes syndrome, R-A-Y-E-S, Reyes syndrome. And we had no idea what caused it. And so these babies would have this syndrome, and we would ask the moms every single question we could possibly ask. And so, of course, they were different on some things and the same on others. Turns out we found out that it was aspirin that was associated with this. And so now that we avoid giving babies aspirin, now we don't see Reyes syndrome like we used to. But it took a long time to figure that out because we're just kind of in the dark. We're asking all these exposure questions. We have no idea which one of them is going to end up being the one of interest. So the controls, we really want to be very similar to the cases. And so think about it this way. If those two groups, cases and controls, are similar for every single variable except for the exposure that we find out is the important one, then what we can say is that the exposure is associated with being a case and the absence of exposure is being associated with being a control. And so that's in a perfect world, 100% of cases would be exposed and 100% of controls would be not exposed to that particular thing. And again, that's in a perfect world. But that's really what we're shooting for in terms of a case control study. And then we ask all of these questions, and here's one of the important things to keep in mind. When we're asking all of these questions about all of these different exposures, the people that we're asking already know if they're a case or if they're a control. So those infants with a neural tube defect, we asked the moms about all different kinds of exposures. Did this happen during your pregnancy? Did you take prenatal vitamins? Do you eat this food? Did you travel? Did you have some infectious disease? Did this or that or something else happen to you during your pregnancy? Dozens of possible exposures. And what we found is that a specific vitamin, folic acid, was quite strongly associated with neural tube defects. Or actually, the absence of folic acid was strongly associated with neural tube defects. And so when women took a multivitamin early in pregnancy, and it really had to be very early because that neural tube is forming during the first month of pregnancy, that there were very few neural tube defects if that pregnant woman took the multivitamin that included folic acid. So of all of those things that we asked, that was the thing that surfaced. And so now, based on that, if we can eliminate folic acid deficiency, then that helps to eliminate neural tube defects among the babies that are born. So because this group, the thing that I was getting at, because this group already knows that they are cases or controls, that throws an interesting twist into this asking exercise. So we're asking them to remember things that have happened in the past. So imagine yourself, I want you to close your eyes and I want you to imagine yourself. You are a brand new mom. You had a baby that had a neural tube defect, which often is devastating to this young mother and family. And if she goes over this in her mind over and over again, she's thinking, what could have happened? Did I fall? Did I do something wrong? Did I eat the wrong food? What did I do that could have possibly caused this? And so her memory of possible events is very sharpened, is very different than the memory of the mom who had a perfectly normal new baby. The normal baby, maybe she answers the same questions and she's like, nope, that didn't happen. Nope, that didn't happen. No, I don't remember that. No, I don't think that was true. And so what this is called is recall bias. BIAS, if you can read my handwriting there. So if you recall, when we talked about random error, and other kinds of ways of evaluating an association. We had random error, which is chance, systematic error, which is bias, reverse cause and effect, and confounding, and then we get to our causation. That systematic error, recall bias, is a type of systematic error, and it's especially problematic to have that systematic error or bias when it is different, and here's the key, when it's different for the cases than it is for the controls. And that if that systematic error is different for the cases and controls, it has a special name in epidemiology. It's called differential bias. In other words, if the cases recall exposures differently than the controls do, then we can have this error or this mistake. We were wrong. We collected information that's incorrect, this bias. So that would be one of the important limitations of a case control study, is this recall bias. Now, a strength could be considered that if you remember when we were talking about this, here we are at the point of collecting data. Well, we know the cases have occurred. We know that the controls, they have not had the disease occur. And we ask them all these questions about things that happened in the past. And so all of the information is collected at the same time. You literally sit down with the questionnaire and you say, okay, does this particular infant have a neural tube defect or not? And then here's our whole entire questionnaire that goes with that particular case or with that particular control. And so we're asking about all these exposures, maybe at different times during pregnancy or even before pregnancy, or we're collecting information about the mom or the baby, and we're collecting it all at once. And what that means is I can't lose track of somebody. If I collected information on a case, I have the information for that particular case. If I collected information on one of the controls in that particular study, I have the information for that control. I don't have to wait for a year or 10 years or 25 years for that particular person to show up as having the disease or not, as I do in some other kinds of studies. And so I do not have any loss to follow-up just based on the way that the study works. And so that can be a real strength. I'm not losing track of people over time. And so that can be a real strength for a case control study. It can be quicker. Because I can collect information on lots of cases and then choose how many controls I have, I can control the expense of the study. So time and money can be a real plus for case control study design. So in this video, we've reviewed the basic features of a case control study design, some of the limitations and strengths for that particular design. We can study things that are rare. And so maybe we only have 10 or 20 cases in a large population. We can study all 10 of them in a case control study design. So I hope this has been helpful to you in terms of reviewing case control study design. Thank you for joining me.